Hello, my name is Ellen Harrell. I'm the Community Health Nurse Manager for the Office of HIV, AIDS, and STD. And today we're going to talk about HIV and World AIDS Day. In Southern Nevada, we're probably over the past couple of years seeing 200 cases, new cases of HIV infections every year. What we're seeing is nationwide, probably over 60,000 cases of HIV infections every single year. If someone tests positive, it's very important to get counseling and to understand what it means and to get into the medical system as soon as possible. We do have the early intervention clinic where we have a physician who comes in. We're able to do a number of tests, including tests on how the person's immune system is doing, and then be able to refer people out at some point. Although we don't have a cure, we still have some very good medications, very good treatment. Get people into treatment as early as possible. We can keep the virus at bay in the body. We will also, if people are in early treatment, it will also help to lower the viral load that's in the body, which means that it's not as easily transmittable. The treatment options that are available for people can be, some of them as what sounds as simple as good nutrition, mental health counseling, keeping people as healthy as possible, can also go into drug treatments that are available. If you can answer yes to some of the behaviors that I'll bring forward now, you should be tested. If you have injected drugs, any type of drugs, including steroids, and have shared needles and syringes with people, if you have had unprotected vaginal, anal, or oral sex, so if you've had multiple partners, if you have had unprotected sex, if you have had sex for drugs or money, if you have had sex with men who may have had sex with men, if any of that has occurred, then you should be tested. The Centers for Disease Control and Prevention, the CDC, did recommend that healthcare providers should actually test everyone. 1 out of 5 of the million people in this country who are infected with HIV do not know that they are infected with HIV. And if everyone can know what their HIV status is, they can get into early care and have better health for themselves, and they can also protect any partners that they may be with. People who have HIV infection are at risk for a number of other diseases. So we also do encourage people who may have been tested positive or treated for hepatitis, tuberculosis, and STDs to also get an HIV test. We have different kinds of HIV testing. We certainly have the test where we take your blood and send it out to the lab. Takes about a week to get the test result. We also have some rapid testing where people may be able to get a preliminary result in about 20 minutes. We do have confirmation tests, so if there's any type of an indeterminate or a positive that we get from that initial test, we will always go ahead and do a confirmatory test. Along with the testing, you will also get some counseling and some prevention messages. We do testing here at the Southern Nevada Health District. We do routine HIV testing along with STD testing, certainly in our STD clinic, but we also do have an HIV area where people can go in and do testing, and people are more than welcome to come to any of our outreach sites, and we do free testing at the outreach sites. The groups that have been disproportionately affected with HIV are men who have sex with men, and also the African American community, both males and females, and also the Hispanic community. I can tell you for African American females nationwide, they are at a 15 times the risk that white women are for developing HIV infection. Probably the biggest myth that's still out there is that people who have HIV can spread it in the workplace or at home, and it is just not contracted as casual contact, not at all. People with HIV infection are still discriminated against. World AIDS Day, which is December 1st this year, the theme is universal access and human rights. It's important that people who are infected with HIV and have developed AIDS, that they're not discriminated against. HIV is not easily contracted. It is a sexually transmitted disease, or it is transmitted by people who are sharing needles while they're injecting any type of drugs. It's been over 25 years since we've been battling this epidemic in this country. And because there are drugs that are out there that help decrease the viral load in the body, I think people think that it's not going to happen to them. It's just become a disease of the past. It has not gone away. People may have forgotten that we still have HIV infection, that children still can get infected with HIV, that adults will go on to develop AIDS, and at this point we still have no vaccine and no cure. Information about our clinics and both HIV and STD testing is available on our website.